Okay, thank you. So it's now we are moving forward with full energy, and I'm sure like everyone is well awake. Some of us are here in the morning with coffee, and some of you are like in the afternoon, maybe after lunch. So it's my great pleasure to introduce our moderator for today's session, Assistant Professor Brown Alamayo from Rutgers Business School, Newark and New Brunswick. Dr. Alamayo is a distinguished health economist, applied statistician, and educator with over 2 decades of experience in health economics, outcomes research, and advanced analytics. He currently serves as Assistant Professor of Professional Practice at Rutgers Business School, where he teaches business statistics and enterprise architecture. His academic contributions span several respected institutions, including Rutgers University, Baruch College of the City, University of New York, Lansing Community College, and the University of Texas. Dr. Alamayo earned his doctorate in health economics and health policy from the University of Michigan and holds a master's degree in mathematical statistics from the University of Texas. In addition to his academic career, he has held senior leadership roles at leading global organizations, including Merck, AstraZeneca, Novo Nordisk, and Medco Health Solutions, where he led teams in clinical and real-world data analysis across multiple therapeutic areas. I want you to pay attention to these comments. His work has a national impact, including research cited in the 2012 United States Supreme Court decision on the Affordable Care Act. Dr. Alamayo brings a rare combination of rigorous analytical expertise and real-world industry leadership, making him exceptionally well-situated to guide today's discussion. Please join me in welcoming Dr. Brown Alamayo as our moderator.
Thank you, Dr. Naugao. I really appreciate that glaring introduction. Appreciate that. Thank you. Good morning and good afternoon or good evening again, everybody. Thank you for joining us for this important conversation on applied AI in healthcare from local and global perspectives. As mentioned repeatedly across the world, particularly in low and middle income countries, health systems continue to face significant challenges, including shortages of trained healthcare professionals, fragmented data systems, limited infrastructure, and high burden of preventable disease. Yet, we're also at a pivotal moment. Advances in artificial intelligence present new opportunities to help health systems leapfrog long-standing constraints and reimagine how care is delivered more efficiently, equitably, and at greater scale. To frame this discussion, we'll begin with two presentations today. First, the local perspective presented by Dr. Egbe of Bahar Dar University. The title of his presentation is AI Application in Resource Limited Settings, Trends, Challenges, and Opportunities, followed by the second speaker on the global perspective, the presentation presented by Dr. Egbe Osifo-Dawodu of Anandaj. The title of her presentation is AI in Clinical Practice, Global Insights and Implementations. Following these presentations, we'll transition into a panel discussion featuring the two presenters, Dr. Egbe and Dr. Egbe, in addition to Dr. Adefemi Afalabi, reader in surgery at the College of Medicine, University of Ibadan, Nigeria, and Professor Muhammad Manga, Gombe State University, Gombe, Nigeria. So the panel discussion focuses on 4 subtopics, including practical AI use cases in Africa. Second one is infrastructure and data limitations. The third subtopic is ethical considerations in low resource settings. The last one is capacity building and workforce development. Together, this panel brings researchers, clinicians, and innovators who are actively shaping the future of healthcare through technology. Our goal today is not simply to explore what AI can do, but to critically examine how it can be implemented responsibly, ethically, and at scale, strengthening health systems and improving population health outcomes across Africa and the developing world. I look forward to an engaging and thoughtful discussion on both the opportunities ahead and the challenges we must navigate to ensure that the AI revolution in healthcare truly benefits all. For the sake of time, I would like each panelist to take a few minutes to introduce themselves with great apologies. And I'll start first with introduction. So first I'll go to Dr. Gabao. Dr. Gabao, if you can briefly introduce yourself, just a minute or two, and then we'll go to Dr. Egbe, and then we'll continue.
Okay, thank you, Professor. So I'm Gabriel, an internist by profession, a medical doctor, and who specialized in internal medicine. I'm also vice head of department at Department of Internal Medicine, College of Medicine and Health Science, Vardar University. I also hold a postgraduate diploma in advanced leadership from Nile Executive Leadership Academy in Vardar University. I'm a young researcher and community servant. Thank you very much.
Thank you, Dr. Gabel. Thank you, Dr. Egbe.
Hello, my name is Egbe Osifo-Dawodu. I'm a partner at the Another Group, and we basically provide strategic and financial advisory services in the healthcare space. We've worked in over 30 countries, several of them in Africa. And one of the proudest things we are partners with P2P. And I think our involvement on AI built on the involvement during the COVID-19 crisis, when there was a significant sort of knowledge gap all over the world. So I'm really excited to be here. And just to plug AI and PCP and that we've been running bi-monthly seminars. And so actually I'll be drawing some information from there. So thanks very much. I'll be putting a link to that in the connection. We are also doing a survey to understand people who work in Africa, where you are in AI. Please fill the survey. Thank you very much.
Thank you. Thank you very much for that intro. Next, Dr. Afolabi, if you can briefly introduce yourself, please.
Good day, every part of the world, whether it's morning, afternoon, night, dawn. Madepemi Afolabi, primary day lecturer at University of Nigeria. I'm the grade level of leader, otherwise called associate professor. I am also a consultant general surgeon with a special interest in endocrine surgery. I train medical students, train resident doctors for specialization. I care for patients, and I have tested in public health awareness, terror disorders, and I have been obtained Faculty of Clinical Science in my university. And also was Director of Clinical Service Training at University College of Ibadan and Chairman of Medical Advisory. Currently, I hold a post that they consider to have some influence on lecturers and even teachers in Ibadan. I'm the chairman of the Academic Staff Union of University. Thank you very much.
Now, Dr. Afolabi, maybe for the panel, if you can adjust the speaker, there is an echo, so that it was not clear. So if you can adjust that, that would be wonderful. Thank you for that again. Okay.
I was trying to use a Bluetooth so I can hear everybody. Okay, I've put that off already.
Yeah, now it's good. Now we can hear you. Now we can hear you. Now it's good. Perfect. Thank you. Okay. The last but not least, Professor Mohammed Manga. Could you please introduce yourself briefly?
Okay, thank you. Thank you very much. I don't know if I'm audible. Can you hear me?
Yes, yes, you are. Yes.
Yeah, thank you very much. My name is Mohammed Manga. I'm a medical doctor, a clinical microbiologist. I work with Gombe State University and Federal Teaching Hospital, Gombe. I'm the immediate past provost of the College of Medical Sciences, Gombe State University. I am a specialist clinical microbiologist and at the same time having some extra knowledge and information in clinical education. So I am very happy to be here, but my main focus here is trying to combine clinical education, transdisciplinary approach to the fight against infectious diseases, with emphasis on sexually transmitted infections.
Or appropriately, AI can be a golden bridge. AI can be a golden bridge, filling the gap between resource limited and resource rich settings by equalizing global health equity. When we see Ethiopia's progress, or where Ethiopia is on the global stage when it comes to digital health, this isn't a theoretical feature. We are now embracing a digital era. So the blueprint
Dr.
launch.
Apologies. People are asking, do you have any PowerPoint that you can share? Sorry about interrupting, but
Okay.
do you have a PowerPoint, or you can? I think people are asking if there are PowerPoints.
Yes, I can share.
Okay, thank you. I think that will be great so that people can follow up. Apologies for interrupting.
So Ethiopia launched a digital health blueprint in 2023, and we expanded our digital health information system based national reporting in 2024. And by June 2024, Ethiopia developed a national artificial intelligence policy. And now in late 2025, we adopted the WHO-supported AI-assisted TB detection system, which is being implemented in the central city Addis Ababa, as well as some regions, including Amhara, where Bahar Dar University is located, Oromia, and Tigray. So when we see the global landscape, it will be presented later, I think, but we now have more than like thousands of authorized AI tools to be used in medicine, from imaging to cardiology and genomic studies. What are some of the applications of AI in healthcare, particularly in resource-limited settings? Now, AI is transforming diagnostic, particularly in resource-limited settings. It is being used for predictive analytics and risk stratification. According to studies done in the West, artificial intelligence enhanced chest CT scans can now detect lung nodules at an accuracy level of around 98.7%, which is higher than professionals. And AI-driven skin lesion assessment systems can detect skin malignancies, including melanoma and other skin conditions, with an accuracy rate that is equivalent to 21 well-trained dermatologists. And diabetes now is prevalent both in resource limited settings and the developing setting. And now we have autonomous retinal screening for diabetic retinopathy, which has a very high rate of accuracy. The other application is in health data management. Medical data is exploding exponentially. It doubles every couple of months. And this data has to be managed in some better way. And this is where AI excels at collecting, storing, normalizing, and tracing data sets. And we now have general practitioners who can access treatment pathways that can only be given in a tertiary center through artificial intelligence that can analyze both structured and unstructured data to identify evidence-based personalized treatment options, not only in clinical practice, but AI is a tireless research assistant nowadays if used in a responsible and ethical way. Not only in research and clinical care, health assistance and administration nowadays artificial intelligence-enabled digital assistants and transcription systems are reducing the paper-based administrative load and improving overall health administration system. Beyond the regular medical care, now AI is integrated into the genomic sequencing, targeted therapy, particularly in cancer and other autoimmune patients, and AI risk stratification is being implemented. And we now have robotic surgery and microsutures, which can be implemented from a distance. Another more important advantage of AI is in medical education. So in medical education, I'm sorry, now AI has transformed medical education in some settings, and in resource settings, we expect it to help us a bit in a better way by implementing personalized and adaptive learning systems where AI-driven platforms can tailor learning pace and content to individual students, which can improve retention and competency-based education. AI-powered simulations and virtual patients can provide realistic clinical scenarios for safe and repeated practice, expanding access where clinical exposure is limited. And generative AI and intelligent tutoring systems can support clinical reasoning, note writing, and exam preparation, enabling self-directed education. Another automated assessment and feedback systems, which can be done by AI, helps reduce faculty workload and improves feedback quality. However, artificial intelligence is not without challenges. The most imminent challenge in implementing artificial intelligence comes with the ground infrastructure. So most modern AI workflows assume stable electricity, high bandwidth internet, and cloud connectivity conditions that cannot be taken for granted in many low and middle income countries. So the internet connectivity and data set availability in Africa accounts for 1% of the global AI-ready data center capacity. And where do we fail? We fail because we import systems, and systems that are imported from resource-rich settings will fail when infrastructure fails. The solution lies in implementing tiny machine learnings and on-device artificial intelligence tools that are compressed to run on low-power microcontrollers or edge devices, enabling offline functionality and reducing dependency on the cloud. The other challenge is data scarcity paradox. So data scarcity paradox is a real challenge where modern AI tools require massive curated data sets to perform well, while resource limited settings suffer from lack of quality data, meaning the local data reality cannot match the assumptions of models that were or that are trained based on Western data. And Africa, despite representing more than 18% of the global population, contributes to less than 1% of the global genomic and high quality medical data. And furthermore, more than 60% of the internet text is in English, underrepresenting several local languages in Africa. This causes an algorithmic exclusion where data deserts are made and a black hole appears here. The solution is moving from big data towards data efficient artificial intelligence. Institutional and governance void, technical solutions fail without human and institutional support. There is a clear talent gap. Africa contributes only less than 0.5% of the global AI researchers, and lack of formal AI policies. Fortunately, Ethiopia has an AI policy since 2024, but majority of African nations and other low and middle income countries do not have these policies, and lack of these policies may create biosecurity and privacy risks. There is also a two-step problem where developing nations are required to build basic infrastructure while they are expected to adopt to advancing AI governance. There is also a contextual misalignment. For example, a perfect model which works well in Virginia may fail in Dangla. This may be due to differences in the workflow, cultural norms, and environmental variables. So there is one study which showed facial recognition softwares were significantly less accurate at recognizing darker skinned females as compared to lighter skinned males. This is because the initial entry is culturally misaligned. And the most promising path is the rise of small AI systems which are contextually relevant, cost-effective, and purpose-built for constraints, not scaled for abundance. Another challenge is ethical and emotional aspect. As Professor Naugo earlier said, ethical perspectives matter in artificial intelligence. You cannot sue an artificial intelligence which misleads a medical decision. And in medical education, AI use may compromise patient autonomy, like justice, academic integrity, and other principles of ethics. And one study showed diabetic patients who had compassionate physicians had a lower rate of disease complications as compared to their peers. This shows that empathy and compassion play a major role in medical care where artificial intelligence may lack. Not only challenges, but we have opportunities. As Africa, this could be a golden opportunity to transform our healthcare system from, aid-dependent to a self-enabled system. So nowadays, we have sector-specific opportunities. Artificial intelligence can be applied in various clinical settings, including diagnostics and risk prediction. Clinical decision support system can be implemented using AI, and several public health interventions can be done using artificial intelligence. Worth mentioning here is we at Bahar Dar University have an e-malaria tool, which is AI integrated and which aims at eliminating malaria in malaria endemic areas, particularly Andasa and Chesabai, where every household is registered on this e-malaria app, and we delivered an AI-enabled microscope